Sometimes when people ask me, what do you work as? And I say proudly, I work as a clinical pharmacologist, and I see a big question mark on their faces. These lines are for those who don't know the power of a clinical pharmacologist. First of all, tell me, have you ever wondered what happens between a doctor writing a prescription and a patient getting better? There is an invisible bridge between the prescription and the person. This is none other than built by a clinical pharmacologist. And today I want to speak not just about the profession, but I want to speak about the purpose. We don't wear a stethoscope. We are not always the first face to the patient, but we are there, quietly, critically, behind every safe dose, every rational prescription, every recovery that don't turn into a complication. While others treat the disease, we tame the medicines that treat the disease. We are the scientific conscience of drug therapy. We hold the power to prevent a fatal drug interaction, to stop unnecessary antibiotic use, to optimize a cancer regimen, to protect a child from overdose, an elderly from polypharmacy, a mother from drug induced birth defect. It's not just a job, it's a responsibility. In the world of overflowing with the new medicines, quick fixes, online myths, and self medication trends, we are the voice of reason. We bring science to the bedside. We bring safety into the system. We bring ethics into everyday prescription. We train the healthcare professionals. We educate the public. We lead the research. We save lives sometimes without even meeting the patient. Every medicine has a story, not just of chemistry, but of care. Behind the tablet you swallow, behind the IV drip in the hospital room, there is someone ensuring it's the right drug, right dose given at the right time. We are the guardians of safe medicine use. We are not always the one diagnosing the disease, we are not always the one performing the surgery, but we the one who ensure that every medicine prescribed what it's supposed to do without causing harm. We double check the prescription, we identify the drug interaction, we counsel the patient, we correct the errors before they become a tragedy. In silence, we protect lives every single day. Our strength lies in a perception. We understand how medicines behave in the body and how bodies behave with the medicine. We don't dispense, we educate, we evaluate, and we advocate. We stop the wrong antibiotic before resistant build. We catch a life-threatening mixing of the drug. We ensure a child gets a safe pediatric dose. We guide the patients who are scared, confused, and overwhelmed by medicines. In critical care units, in oncology ward, in transplant centers and community clinics, we are there reducing the medicine errors, improving the patient outcome, supporting the doctors with evidence-based recommendation, empowering nurses with a practical guidance, and more importantly, ensuring patients leaves with knowledge, not just with the prescription. We are the clinical pharmacologists and the final defense against medicine mishaps and the voice of patient empowerment. It's also a message to all my fellow professionals: stand tall, speak up, share your knowledge because the world needs more safe medicine champions than ever before. So, today I urge you to be proud of this post, be fierce in your science, be kind in your counsel, be bold in your belief, and that's the clinical pharmacologist who are the invisible strength behind visible healing. Because medicines don't save life, the right medicine used in a right way do, and we make that happen. Proud to be a clinical pharmacologist.